Welcome to Sovereignty Life. In no way am I a health professional or offering medical advice. Mesothelioma is a cancer that arises from the mesothelial cells that line the internal walls of the lungs. The cancer may spread to other parts of the body, including the brain and other organs. In some cases, mesothelioma is a rare and aggressive form of cancer that affects the thin layer of tissue that covers many internal organs, most commonly the lungs. Mesothelioma is often linked to exposure to asbestos, a mineral once widely used in construction and other industries. Although it's not as common as other types of cancer such as breast or lung cancer, mesothelioma can be just as deadly. In this blog post, we'll explore what exactly mesothelioma is, how it develops, who is at risk for developing it, its symptoms and treatments, all from a medical field perspective. So sit back and learn about this devastating disease that has affected so many lives. Mesothelioma is a rare type of cancer that occurs in the lining of the lungs, abdomen, or heart. It's caused by exposure to asbestos fibers, which are inhaled and become lodged in the body tissues. Over time, these fibers can cause inflammation and scarring that eventually lead to cancer. One of the most troubling aspects of mesothelioma is its long latency period. It can take 20 to 50 years for symptoms to appear after initial exposure to asbestos. This means that many people who have been exposed may not show signs until much later in life. There are three main types of mesothelioma: pleural, lung, peritoneal, abdomen, and pericardial, heart. The majority of cases occur in the lungs, with symptoms including coughing, chest pain, shortness of breath and fatigue. Although there are treatments available for mesothelioma patients such as surgery, chemotherapy and radiation therapy, unfortunately there is currently no cure for this disease. Early detection through regular screenings can be helpful if you've been exposed to asbestos or work in an industry where exposure is possible. How does mesothelioma develop? Mesothelioma is a type of cancer that affects the mesothelium, which is a thin layer of tissue that covers most organs in our body. This disease develops when asbestos fibers are inhaled or ingested and then become lodged in the lung tissue. Over time, these fibers can cause inflammation and scarring within the lungs, leading to genetic changes that may eventually result in cancer. Once mesothelioma forms, it can spread rapidly throughout the body due to its ability to infiltrate surrounding tissues and organs. In some cases, it may even metastasize to other parts of the body through the lymphatic system or bloodstream. The development of mesothelioma is often slow and gradual, with symptoms taking years or even decades to appear after initial exposure to asbestos. During this latency period, individuals who have been exposed to asbestos may not experience any noticeable symptoms but are still at risk for developing this deadly form of cancer. It's important for those who have been exposed to asbestos, whether on the job or through secondary exposure, to regularly monitor their health and seek medical attention if they notice any unusual symptoms such as chest pain or difficulty breathing. Early detection plays an essential role in effective treatment and improving long-term outcomes for people with mesothelioma. Who is at risk for developing mesothelioma? Mesothelioma is a rare and aggressive form of cancer that affects the mesothelium, which is a thin layer of tissue that covers most internal organs. It's caused by exposure to asbestos, which was commonly used in construction materials before its health risks were known. But who exactly is at risk for developing mesothelioma? People who worked in industries where they were frequently exposed to asbestos are at high risk for developing this disease. This includes workers in shipyards, manufacturing plants, construction sites, and automotive repair shops. However, it's important to note that even people who weren't directly exposed to asbestos can still be at risk if they come into contact with someone who handles or works around it regularly. Additionally, family members of those exposed to asbestos may also be at risk due to secondhand exposure. Other factors that may increase the likelihood of developing mesothelioma include smoking and having a weakened immune system. Anyone with a history of significant asbestos exposure should speak with their healthcare provider about monitoring for potential symptoms of mesothelioma or other related diseases. What are the symptoms of mesothelioma? Mesothelioma symptoms can vary depending on the type of mesothelioma and stage at which it is diagnosed. The most common symptom of pleural mesothelioma, which affects the lining around the lungs, is chest pain and shortness of breath. Other symptoms include persistent coughing, hoarseness in voice and fatigue. Peritoneal mesothelioma, which affects the lining surrounding abdominal organs, causes abdominal swelling or bloating, nausea and vomiting, bowel obstruction or changes in bowel movements. Symptoms for pericardial mesothelioma that affects heart tissue are chest pain or tightness, irregular heartbeat and difficulty breathing. Another rare form of mesothelioma known as testicular mesothelioma may cause swelling or lumps in testicles along with other severe complications like hydrocele. It's important to highlight that these symptoms are not exclusively indicative of mesotheliomas alone, so it's essential to consult a doctor if you have any unusual health problems that persist over time. How is mesothelioma diagnosed? Diagnosing mesothelioma can be a challenge for doctors due to the similarity in symptoms with other lung diseases. The process typically begins with a review of the patient's medical history and exposure to asbestos, as this is the primary cause of mesothelioma. After that, a physical examination will be conducted to check for signs such as lumps or fluid buildup in the chest or abdomen. Doctors may also order imaging tests such as X-rays, CT scans or MRIs to get a better look at any abnormalities in these areas. If cancerous cells are detected during an imaging test, further tests are done by taking tissue samples through biopsy, which helps confirm whether it is mesothelioma or not. In some cases, additional testing like PET scans may also be required to determine if cancer has spread beyond its initial location. It's essential for patients who have been exposed to asbestos and show symptoms of lung disease consult their doctor promptly so they can undergo proper diagnosis and treatment if necessary. Early detection is crucial because it increases chances of successful treatment and improved prognosis. How is mesothelioma treated? Mesothelioma can be a difficult cancer to treat due to the fact that it is often diagnosed in its later stages. However, there are several options available for treatment. The type of treatment recommended will depend on various factors such as the stage of the cancer and the overall health of the patient. Surgery may be an option for some patients, particularly if the cancer is localized and has not spread to other areas of the body. Chemotherapy may also be used to help shrink tumors or slow their growth. Radiation therapy can also be effective in killing cancer cells. In addition to these primary treatments, patients may also receive supportive care such as pain management or nutritional support. Clinical trials are another option for some patients who wish to try new therapies that are still being researched. Each patient's situation is unique and requires an individualized approach when it comes to treatment options. It's important for mesothelioma patients and their families to work closely with their healthcare team throughout every step of the process in order to determine what course of action will provide them with the best possible outcome. What is the prognosis for people with mesothelioma? The prognosis for people with mesothelioma can vary depending on factors such as the stage of the cancer, age, overall health, and treatment options available. Unfortunately, mesothelioma is often diagnosed in later stages when it has spread beyond the initial site of development. Individuals diagnosed with advanced stage mesothelioma may have a shorter life expectancy than those who are diagnosed earlier. However, early detection and treatment can improve survival rates. Treatment options for mesothelioma typically include surgery, radiation therapy, chemotherapy, or a combination of these approaches. Patients receiving all three treatments generally have better outcomes compared to those who receive only one or two types of therapy. Clinical trials also offer hope for patients with mesothelioma by providing access to new treatments that may not yet be widely available. In general terms, though, unfortunately there is no cure for this type of cancer and life expectancy varies from individual to individual. It's important to discuss prognosis and treatment options with your healthcare provider so you can make informed decisions about your care plan moving forward. Mesothelioma is a type of cancer that affects the lining of internal organs. It develops after exposure to asbestos and can take decades to show symptoms. While there is currently no cure for mesothelioma, treatment options such as surgery, chemotherapy, and radiation therapy are available. It's important for those who work in industries where asbestos exposure may occur to take the necessary precautions and follow safety guidelines. Early detection through regular medical checkups can increase the chances of successful treatment. While more research is needed regarding effective treatments for mesothelioma, advancements in medical technology provide hope that better outcomes are possible in the future. As with any type of cancer diagnosis, seeking professional medical help promptly can make all the difference in managing this disease.